Hello, we will today check our patient's ASAP's case. If we check his preoperative pictures, it doesn't seem that he needs a lot of hair. But when we comb the hair, we can see that the front part looks nice when it's combed. But when you comb to the other side, you can see that he lost a lot of density in the front and the midsection of the head. He also needs some density increase in the crown, and there's a linear part from front to the crown that he lost most of the density. So we will check his pictures after we shave the head, and you can clearly see the density loss in the crown and also in the midsection. So what I planned for this patient, I always want the patient to look natural and nice. So I got the maximum amount of grafts from him without donor zone looking sparse or bad. So I started with the front again, and I increased density in the front and in the midsection. And I also increased the density in the crown. So after that, I moved to the parts which I believe that he's losing density and there are some bald spots. So I increased in the density in the midsection too. We can see that the pictures after the implantation. And in the 13th day, we always want a control picture from photographer from our patients. So you can see that he has nice hair on the top, but again, you can see also that his donor zone do not look really nice, and some people may consider this as over harvesting, but as I always tell my patients, it will look much better in the upcoming months, and it will get its real density after 3 months. We will jump to the 6 months photos here. So you can see donor zone looks totally healed and has a very nice density. And his hair started to grow in the front, but of course it still needs to improve. Someone can still say that he had hair transplant from these pictures, but you see that the crown has its density because his crown was not bald, and even a slight increase in the density in the crown manifests itself like he has full thickness in the crown. Now we will jump to the 12-month pictures. We can see here that his crown looks awesome, his donor zone looks awesome, and his hair in the front is remarkably dense and natural looking. And we get our patient's feedback that it's not really understandable or obvious for a person who doesn't know if he had hair transplant, and he has a very good result too.